If you're just starting off with clear aligners, or maybe you've been doing them for a while but you're struggling to get good results and your cases aren't going as planned, maybe you've been getting some posterior open bites, maybe the teeth aren't moving the way that you and your patients have hoped for, or maybe you just feel completely lost in this process, you could definitely benefit from this video. In this video, I'm going to teach you exactly how I simplified offering clear aligners to my patients, which resulted in me getting over 50 case starts in my first 6 months. 40 to 50% of the treatment that I do today are clear aligners. And that would not have been possible unless I didn't follow this key principle of simplification. One thing to remember, simple scales, fancy fails. If you don't offer clear aligners, or maybe you're new to them, I want to use this concept of simplification and apply it to other relatable aspects in dentistry. So I want you to do this. I want you to take a trip down memory lane. Try to remember the first time you did an extraction. Where were you? Probably dental school, right? What tooth was it? Was it broken down? Was it intact? Was there bone loss? Was it a root canal treated tooth? Was the patient in pain? Was there an infection? Was it easy or hard to get out? I want you to remember your first extraction because anytime you do something new, it's going to be scary. But as scary as it may be, it could be a huge confidence booster. Sure, it may not have been perfect, but you did it. You got the tooth out. You were able to take something away from that experience. If it was easy, guess what? Your confidence went up. If you struggled, you know what you need to look for the next time in your case selection so that way you can avoid that issue. Maybe you enjoyed the experience. Maybe you didn't, but now you have a solid reference point because you can use this experience and move forward. Why? Because you took action and you gave it a try. You tried to do an extraction. Now let's talk about difficulty and simplicity with aligners and relate it back to these extractions. So if we're staying on topic with extractions, you don't want to take on, right, an impacted wisdom to this your first extraction, right? That's just asking for trouble. For me and aligners, I wanted to find the clear aligner case equivalent of a premolar with severe bone loss. Something simple. Something where I didn't need to stress. Something where I didn't need to stress on the technicalities of executing the procedure itself and that I could just trust it's all going to work out. You see, when you do a new procedure, there are so many factors that play into it. The implementation process is daunting. What instruments do you need? Is this set up correctly? What do you say to the patient before treatment? What do you say to the patient after treatment? What do you say to your staff member when they don't know what to do in the middle of the procedure? How the heck do you answer all these questions? All of this stuff adds to the stress of a new procedure, and you haven't even put your hands in the patient's mouth yet. This is why I am a fan of simplifying. Simplify the process from the beginning so that you can build confidence and get the small wins along the way, and then take those wins and multiply them over and over and over and over again. You're probably thinking, wow, that sounds great. I would love to do that, but talking about aligners and actually doing them are totally different. Or you're probably thinking, Doc, it's not that simple to do and I don't even know what I'm doing or if it's even going to work. These are all valid questions because I had the same exact questions when I first started. So you have to have a strategy of simplifying clear aligners for you and your practice. And when you simplify it and you keep it predictable, you're going to get confidence. That confidence is what carries over to your patients. When that confidence increases, that case acceptance is going to go up. There's a direct correlation. Now, I totally hear you about not knowing what to do and wondering if it's actually going to work. Once I realized that I didn't know what I was doing early on, I revisited the online modules that the clear aligner company provided for guidance. Now, this gave me insight and a general overview on the process of aligners, but not that much confidence in all the steps that were happening after a patient agrees to treatment. So then what I did is I attended webinars. These were put on by dentists who are super successful with aligners and they were super valuable, but I felt like these were all kind of like piecemealed together. They picked a topic and they went into detail, which was amazing, but I wasn't getting that comprehensive training that I was looking for, right? Like you want something that's just going to encompass everything and I couldn't find it. I just wanted to sit down and absorb and learn step by step from the beginning to the end, but I couldn't find anything like that. Then I got a shift in my mindset from Dr. Blocker. Dr. Blocker is Invisalign faculty, and I attended one of her lectures while I was researching all these resources to help with clear aligner implementation, and she served as one of my initial mentors with Invisalign when I first started out. Dr. Blocker's support was crucial to my success, and I was able to go with her to the different cases that I wanted to do, and I leaned on her to view and help support my treatment plans. I soaked up as much knowledge as I could, and I'm so grateful for the opportunity to be able to have her support along my journey. So I feel like at this point, I virtually tapped out on all the resources available and I still had some doubts. This is when I stopped looking around and I started to look inward. Before this, I realized I didn't want to do something new and fail. That was my biggest fear without even knowing it. The fear of failure was holding me back. It was holding me back from growing and adopting this new treatment option. I was so afraid that if I couldn't offer this treatment and get perfect results that I didn't want to start. I didn't feel comfortable because I didn't have trust in the procedure. I didn't know if I would be able to deliver perfect results for my patients, and this fear is what was holding me back from trying something new. So this is when I realized if I stop chasing perfection and focus on improving my current patient situation, this is a win. And I simplified the cases I was taking on by not trying to fix everything. I was only focusing on what was causing direct problems that were predictable for me to solve. Of course, I discussed all the problems that the patient had, but I gave realistic timeframes and true consequences if they weren't corrected. And at the end of the day, I shifted to focusing on the patient's chief complaint and doing my best to focus on addressing and correcting that issue. For example, imagine a 55-year-old patient has a crossbite, but it's not causing them any harm. You don't have to correct it. You can mention it to them, but you don't have to correct it. So if that same patient has anterior crowding, and that crowding is causing plaque buildup and gingival inflammation and bone loss, that is something that you can and should correct. That is going to directly improve their oral health and quality of life. This is very predictable to treat. So how do you actually simplify clear aligners? I'm going to tell you my hacks on how to do it. It all starts with case selection. To start simple, you must remember to not take on things that are going to get you stuck, right? Know how to identify what cases to do and what cases to refer. This is going to save you so much time on the back end, and it lowers your stress throughout these initial experiences. I like to treat cases that have like arches, meaning if you have spacing in both arches, that's a good case to treat. If you have crowding in both arches, that's also a good case to treat. Anterior open bites are also super straightforward. You can even treat deep bite cases when there's less than 4 millimeters of deep bite. Cases that are going to get you stuck. They're going to take longer, and they're also better off with orthodontists. These are the cases that I always refer. Bilateral cross bites, class 3 cases, and deep bites greater than 4 millimeters. Remember, referring is okay. In fact, referring is crucial to keeping it simple. I love referring because that means I don't have to waste my time trying to do something out of my scope, and I can let the specialist deliver high quality treatment to my patients. This is how everyone wins. The general dentist gets to add a profitable, fulfilling procedure, and they are directly incentivized to talk more about alignment issues with all their patients because they are able to directly make a difference for their patients. Now, this leads to them referring more cases than ever before to the orthodontist, and more patients get the treatment that they need. So let's not sit here and act like general dentists who don't offer aligners are really driving home the importance of straight teeth and all the oral health benefits that come with it. Dentists are usually only talking about treatment that they offer. And if they don't offer the treatment, then they're going to give a referral slip and move on as quickly as possible. This leads to the patient not feeling the importance of the treatment. It all starts with the general dentist and their team. We are the front lines of oral health in our patients. If we don't talk about something, the patients aren't going to do it. That's just how it works. So some tips for you to further help in simplifying aligners. If you're using Invisalign, utilize Invisalign Pro for ClinCheck support. These are going to help you on the clinical side when it comes to setting up your cases. You could also sign up for my training program. It's an on-demand virtual program for general dentists who are looking to start doing clear aligners. It's called Clear Aligner Advisor, the Mindset Bootcamp. I also offer my students monthly Q&A coaching calls where I assist you in setting up your cases and troubleshooting any problems that come up along the way. I'm not brand specific, and I offer this to all general dentists looking to get started with clear aligners. I'll put the link in the description below. Do me a favor, if you're enjoying this video, drill that like and subscribe button. It really helps me out. Okay, another way to help with simplification, and I know this may seem further down the road if you're just starting, but when you optimize your team and get everyone bought in, this helps keep things simple. Teach your team exactly what you want them to look for, what to say, and how to educate the patient. This will create a basic funnel in your practice for predictable cases to come down the line, and it takes a lot of the legwork out of it and keeps you focused on the cases that you can treat. Now, getting your team on board is not the easiest thing in the world. It takes dedication, and it takes a lot of effort on your end. But trust me when I say this, when you invest the time up front to get the team synced up, this will give you the sustained success that you are looking for. When your team is proactively talking about clear aligners, it becomes even easier to do. It's like muscle memory for everyone, and it changes the game. Now, I want you to imagine the situation. This is how it looks looks like when your team is fully on board with clear aligners. You walk into a hygiene exam and it's very clear that the patient can benefit from aligners. And your assistant and hygienist have already educated the patient about their problems and what a potential solution can be. They showed them the scan of their mouth. They gave them the models of the aligners. This way the patient can see and feel what the aligners look and feel like. They even did a smile simulator to show the patient what type of correction can be done. And all you have to do is walk into the room and tell the patient that they qualify for clear aligners. Then the patient says yes, your team takes your digital records, and all you have to do after that is set up the treatment plan or ClinCheck, make your modifications, click approve, then boom, you're done. Sounds pretty simple, right? So when you simplify cases and you build confidence early on, and you know which cases to take on and which ones to refer, and you get your team on board, you're gonna find success with aligners very quickly. And in this next video, I'm gonna go even deeper into the perfect pitch that you can use when you talk to patients about clear aligners that's going to lead in an explosion of case acceptance. If you're still interested and you're someone who wants to learn more, check out the next video in this clear aligner series. Also, if you're interested in getting started with clear aligners and you want some free training on it, be sure to sign up for my masterclass. The link for it is in the description below. If you enjoyed this video, don't forget to please drill that like and subscribe button and share this with any other dental colleague that you find it may benefit. My goal is to share as much free value and information on this procedure, and I want to help fellow dentists learn and grow together. Thanks again for watching this video. I'll see you in the next one.